Okay, good morning, everyone. Thank you so much for joining us. My name is Barbara Guinn, Commissioner of New York State Office of Temporary and Disability Assistance. Again, thank you for joining us for what we consider a very important briefing on some of the federal changes to the Supplemental Nutrition Assistance Program. We have experienced a situation where we have 1,000-person limit, and we had more than that in terms of individuals who have signed up. So we will be sharing these slides, and we are recording the video of this session as well so that we can share. It is not a problem that we typically have. So thank you. We're glad for the interest. And again, it is a really important topic. We have certainly been sounding the alarm about some of these changes. We have been meeting with congressional offices because we feel that they are very detrimental to the program and to states and local governments. Kathy Hochul, Governor Hochul, has obviously also been sounding the alarm, trying to prevent some of the most dangerous aspects of these bills from going forward. Our opportunity this morning is really to inform all of you and make sure people understand the real impact of the proposals in these the congressional bills, so that individuals are well prepared to also support advocacy on behalf of residents of New York State. Very grateful this morning also to have both Richard Buery and Kate Breslin joining us for commentary after I go through kind of the technical aspects of the bill. They are both members of the Child Poverty Reduction Advisory Council, and also obviously tremendous leaders in their own right in the work they do in the field of poverty. So we appreciate them joining us this morning. I'll go through the presentation, and then we will have opportunity for Q&A. That'll be controlled through the chat. So ask questions at any point that you would like through the chat, and folks are monitoring that so that we can address it after we go through the full briefing. Next slide, please. Oh, next slide. I think probably most of you joining are fully aware of what the SNAP program is, but obviously it provides very important benefits to individuals that they receive on an electronic benefit card, and they're able to use those funds to purchase food at SNAP-approved retailers. So it's really an essential program that helps individuals meet their nutritional needs. It is the largest and absolutely the most important hunger prevention program in our nation. Next slide. In New York alone, the SNAP program helps over 2.9 million individuals each day. Most of the recipients are either children, elderly, or disabled individuals. So again, just a really important and impactful program in terms of helping people be able to afford a nutritional diet. In addition to it supporting individuals, it also is a really strong economic engine for communities throughout our state. So federal estimates alone have identified that every dollar spent in SNAP produces $1.54 in economic activity. So based on the $7.8 billion that is spent in New York through purchasing food through the SNAP program, that provides economic activity throughout our state, in every community of our state, of $12 billion. So it also helps to keep strong communities. Next slide. So since the program was established, since SNAP was established decades ago, the federal government has always funded 100% of the program benefits. So states administer the program on behalf of the federal government, and states and local governments support 50% of the administrative cost, with the federal government covering 50% of the administrative cost. But benefits have always been 100% federally funded. The proposals before Congress in both the House and the Senate bill are taking steps that would shift significant responsibility for the program from a financial standpoint to the states. So this would definitely hurt state and local budgets and undermine the program. We're concerned about it undermining the program because states cannot absorb these costs. You'll see in a minute, they are absolutely significant for New York and every other state. And states have to balance their budget every year. So it's something that states can't afford. And we know that the federal government has the ability to better fund the program even during times of economic downturn. So when states and throughout the nation may be suffering financial difficulties, that's often when the program is needed the most. So we think it's really important that the federal government continue to pay 100% of the program benefits. Next slide. So the House bill that has the bill that has passed the House would shift benefits onto New York State at a value of 1.9 billion every year. The current proposals being debated in the Senate would shift $1.2 billion to New York State. So again, very significant cost, especially when you think about them in the context of all the other changes that are being discussed in other really important program areas that would also have a negative financial impact on states. And so they're justifying this. So they, as people may know, it has been stated they promise to not take actions that would negatively impact recipients. But that's not true. And they are justifying these cost shifts based on payment error rates. And the error rate criteria that they're using would hurt at least 43 of the 50 states. So shifting the cost from the federal government to the states doesn't do anything to help the American people. It's simply shifting the burden, and so taxes will be impacted negatively at state and local levels potentially. Next slide. So with respect to the justification that it's necessary for them to shift some costs to states because states are not paying sufficient attention to payment accuracy. That is simply not true. It is a false narrative. States pay a lot of attention to payment accuracy. New York State and other states, your payment accuracy rate may go up or down in different years. Historically, payment accuracy rates in the SNAP program are relatively low. The slide shows an example of this, just comparing New York's rate in 2019 pre-COVID and the national rate pre-COVID compared to 2023, which is the most recent data available. And so really what happened is, obviously everyone knows during COVID, there were a lot of changes with the SNAP program, adjustments to rules during COVID, and then also as we were winding our way out of COVID. So lots of changes, making it more difficult perhaps for workers to get it right all the time. And then also importantly, we know that state and local governments, just like many businesses around the country post-COVID, were facing major workforce constraints. And so the confluence of these events, as well as increasing need, so increasing caseload, really did result in increased error rates. But these are not typical, so we do not think it's an appropriate justification. States do pay a lot of attention to error rates. Next slide. I think it's also important just for people to know that SNAP already has very rigorous quality control standards, which is why OTDA and social services districts throughout the state do pay a lot of attention to payment accuracy, because there are significant fiscal penalties already in place that require that. And obviously we want to get it right. We want to make sure people are not getting too little benefit or a benefit level that's higher than they should receive. And I think it's important too, just to state that, to be very clear, error rates do not measure fraud. By federal reports have demonstrated that recipient fraud in the SNAP program is in fact relatively low. Next slide. In addition to the shifting of benefit cost, there are also provisions in both bills that would shift administrative cost. So as I said earlier, right now the SNAP program is administered so that 50% of those costs are absorbed by the federal government and 50% are absorbed by states and or local governments. The proposed bills would reduce the federal share to 25% and require a corresponding 75% share for states and localities. So these, when I say administrative cost, these are costs associated with delivering SNAP benefits, delivering other SNAP related services. So staff and other elements that are required to administer the program. And these cost shifts are not insignificant either. So as is demonstrated on the slide, most of this shift would actually not, there is a shift that would impact the state by about 36 million, but even larger amounts, 168 million, would impact local governments, counties throughout New York State. We've provided some examples here with respect to, based on existing expenditures or prior expenditures, what that increased cost would be. And so, for example, Long Island, you can see $10 million increase in cost on an annual basis on Long Island. 10 million additional cost needed to be absorbed by counties in Western New York State. And these costs don't even account for the potential need for states to increase administrative effort to administer some of the upcoming changes, work-related requirements in the bill, and also to continue to make improvements in modernization for systems, as well as other efforts to improve payment accuracy. Next slide. So in addition to shifting significant portions of SNAP benefits to the states, as well as administrative expenditures, both bills also eliminate this SNAP education program. For New York State, that's about a $29 million value associated with this program that provides education on nutrition and obesity prevention. And it also helps inform individuals how to prepare nutritious meals in a cost-effective manner. So it supports healthy communities. As is noted here, in 2024, SNAP-Ed reached more than 217,000 New Yorkers with their outreach activities. And then next slide, you can also see on this slide, it shows within each region some of the providers that deliver SNAP-Ed related services. And then the next slide identifies some of the specific cuts that would be required if the federal government eliminates funding for SNAP-Ed. Again, another not insignificant federal reduction in support for healthy families. Next slide. So just to sum up the cost shifts and the program cuts, the changes would result in up to $2.1 billion cost shift to New York State annually. And again, this is for SNAP alone. We know that there are lots of other programs out there that are also facing the possibility of reductions. We're very concerned, as stated earlier, that these shifts would undermine the stability of the SNAP program, could result in reduced benefits, limited access to needed assistance, and certainly will no doubt increase pressure on state and local government budgets. Next slide. So another very concerning piece of the congressional proposals, both the House and Senate, would take action to significantly increase the number of individuals who receive SNAP who would be subject to time limits associated with work requirements. So these proposals, this is what has long been referred to as ABODs, able-bodied adults without children, dependent children. And the ABOD requirements were suspended during COVID, and traditionally many states have been able to obtain waivers of these requirements based on higher rates of unemployment or insufficient jobs, and also had the ability to exclude particularly vulnerable populations. So there were many provisions in place to protect people from these time limits. And the rules require that an individual who's subject to these rules can only receive SNAP benefits for up to 3 months during any 3-year period during which they are not working or participating in a qualifying activity for at least 80 hours a month. So we know that people receiving SNAP may be, many people are working and they will be able to meet this requirement. Other people may be working, but their work hours fluctuate from week to week, and they don't necessarily have control over that, but they're dependent on their employer or employers providing them sufficient hours to meet the requirement. And you know, we do agree that the best pathway out of poverty is often working, and we do encourage and support work, but we do not support the SNAP related provisions because of the way they are really overly onerous. And like I said, place a very strict time limit. And they're not really focused on employment outcomes. I think history has shown that it does, in fact, reduce access to SNAP, but it does not necessarily lead to stronger employment outcomes for individuals. And so the changes, which are still, as of yesterday, there was yet another change here in the Senate. We know that the House bill would apply these new requirements to households who do not have a child under 7 years of age. So that would bring in a large new group of households with children to be subject to these rules. And the latest Senate change from yesterday is it would apply to households who do not have a child under 14 years of age. Before yesterday, it was under 10 years of age. So it is still an evolving policy that the Senate, at least, is continuing to kind of determine where they will land on this. And so next slide. We'll give you a little bit more information on the impact. And I'm sorry, there is one other important group that would newly be subject to these requirements, and that would be individuals 54 to 64 years of age. So it's also really important that while these proposals are being forwarded, there is no additional funds to help counties in New York or other states help individuals to implement this work program and to help individuals get to work. And neither bill provides additional full federal funding to meet any necessary childcare or transportation costs that individuals may require to be able to go to work. We have been pushing for an alternative to encourage work, would be for the SNAP program to increase what's referred to as the earned income disregard. So that encourages work by letting people work, have income in their household, and they would receive a reduction in SNAP, but not as quickly. So they would be able to retain more of their earnings and more of their SNAP at the same time, which really has been shown to be an incentive to getting people to work. Next slide. So this is our analysis with respect to assumptions of what we expect in terms of households that would likely face losing some or all of their SNAP benefits as a result of the expansion of the time limits. I must say that these numbers do reflect the Senate version under 10 as opposed to the under 14, since that just happened yesterday, but we do not expect that to make a significant change in these counts. But as you can see, it's a significant loss of SNAP for households and also for communities throughout our state. And one additional eligibility piece that is in the House bill and maybe in the Senate bill is a further reduction, or a further restriction on when non-citizens, so legal documented non-citizens in our country can receive SNAP. SNAP already has very stringent limitations with respect to when non-citizens can receive SNAP benefits, and the proposals will potentially result in a change to further restrict so that only legal permanent residents and other very small groups would be able to receive SNAP. And so that we're estimating right now that that would impact about 50,000, over 50,000 households in New York State. Next slide. And so, as we said earlier, SNAP not only helps households, but it also helps our entire food food network. So it boosts local economies, it helps farmers, it helps retailers, and reductions at SNAP expenditures will certainly have a reduction for those industries, and that includes again grocery stores, farmers markets. We have over 18,000 SNAP retailers in New York State, so they too should be concerned about limitations on efforts that will reduce households' ability to purchase food. Next slide. So we certainly have been urging members of New York's congressional delegation to oppose these cost shifts, and again, informing individuals about how these really will negatively impact recipients of SNAP as well as communities throughout our state. We want to make sure people continue to have access to food, and it's really important that SNAP remains the most important and it's both efficient and large program to reduce hunger throughout our state. And so with that, I am going to quickly turn it over to Richard Buery. Again, Richard is CEO of Robin Hood, New York City's largest organization committed to lifting households out of poverty. And again, he is a prominent member of the Child Poverty Reduction Advisory Council. And so we thank you, Richard, for making some remarks for the group this morning.
Thank you, Commissioner. Thank you so much for having me, and good morning, everyone. It's great to be with you all, although I wish we were on a better topic. I just want to spend a few more minutes just giving additional context to the Commissioner's remarks. Our work at Robin Hood is based in New York City, and I wish I could say that here in New York City that we were on the verge of a hunger crisis, but that would not be true. We're already experiencing one. The challenge is that the budget reconciliation bill would turn that crisis into a deeper tragedy. Data from our poverty tracker report, which we put out with Columbia University, paints a very stark picture. In 2023, 1 in 3 adult New Yorkers, 31%, experienced food hardship. And nearly half of all families with children in our city, 44%, struggle to put food on the table. We've seen that food pantry usage has more than doubled since before the pandemic, from 1 in 5 New Yorkers in 2019 to 1 in 3 in 2023. It's not only the poor who rely on these food pantries. A broad cross-section of New Yorkers, including folks with stable jobs who don't receive SNAP benefits, rely on food pantries to make ends meet. Families who can't skip a rent bill or a utilities bill will often skip a trip to the supermarket and rely on food pantries again. And I say all this because our food pantry infrastructure is already deeply stretched and overburdened trying to meet today's needs. And now, just as that need is critically high, SNAP, the lifeline and foundation of our national anti-hunger strategy, is under threat. We heard from the Commissioner the deep impact that SNAP has on supporting New Yorkers and Americans generally, keeping millions out of poverty, keeping millions fed. She also spoke about the powerful economic multiplying effect. The truth is that SNAP is a federal program that actually works. It delivers on its mission. But these proposals that the Commissioner has been talking through would mind-bogglingly demolish this highly successful program. It proposes slashing nearly $300 billion from SNAP through 2034, a staggering 30% reduction in the program that dwarfs any previous cuts, including the cuts from '96. Just historically unprecedented underinvestment. Millions of people nationwide, including over 2 million children, will lose some or all of their food assistance. And what is most jarring for me and for most of us, and for many of us, is that these cuts are used in part to pay for tax cuts skewed heavily towards the wealthy. So we are literally proposing to take food out of the mouths of children to fund tax breaks for those of us who need them the least. We should expect hunger rates and pantry usage in New York City to skyrocket even further if these SNAP cuts become reality. The math is just brutal. Drastically reduced federal funding colliding with an already overburdened emergency food system. Uh, so what does this mean for us? Obviously, as you heard all those stats, all the impacts, cutting SNAP in this way would be both a moral disaster and an economic disaster. And we just have to figure out how we can organize our communities to fight it, in addition to understanding exactly what the far-reaching effects are. I know it'll take local and state officials working alongside those in the front lines of the fight against hunger to make this issue relevant and urgent for our neighbors and for the elected officials who represent them. We know the data. We just heard the data. We know the threat. We know the human cost. And my favorite saying is that when you know, you act. So let's work together to ensure that no New Yorker is left without the basic necessity, the basic human necessity of food. It is really exciting that so many people came here to sort of talk about, to understand and coordinate on it. And Commissioner, I really appreciate you bringing us together and giving me a moment to talk to the group. Thank you.
Thank you so very much, Richard. Appreciate it. And we appreciate the work that you do every day, fighting poverty in New York City. Next, we will hear briefly from Kate Breslin, who's the president and CEO of the Schuyler Center for Analysis and Advocacy. Kate has been dedicating much of her time and energy for many years, making sure to advance the needs of children and others in poverty as statewide advocacy for New Yorkers. So I will turn it over to Kate Breslin, another member of the Child Poverty Reduction Advisory Council.
Good morning, and thank you, Commissioner. It's great to be with you all, and as my colleague Rich said, unfortunately on a challenging topic. There are more than 4 million children growing up in New York, and the policy and budget choices that our leaders make right now will affect them for their lifetimes. Experiences in childhood are critical determinants of a child's opportunity to thrive today and throughout their lives. Nearly 1 in 5 New York children are experiencing poverty, with many more just above poverty and still struggling. That means more than 1 million New York children don't have access to basic necessities like stable housing or regular meals. And while so many children are already in need, the cost of raising children continues to rise. Poverty is a problem accelerant. Any challenge or concern that a child or family faces, poor health or mental health, academic challenges, is likely to be exacerbated by limited financial resources and poverty. Columbia researchers identify myriad benefits of mitigating child poverty: future earnings, child protection cost avoidance, and long-term health. It is in this context that national policymakers, the President, the U.S. House of Representatives, and U.S. Senate are seeking, finding, and voting on ways to reduce the number of low-income people who can get food, reduce the numbers of low and middle-income people, children, adults, people with disabilities, older adults, military families, who can get affordable health coverage, and shift billions of dollars in costs to state and local governments. The provisions of the bill passed in the House of Representatives equate to over $10 billion in annual losses for New Yorkers and our economy. People will still need health care. People will still need food. Health centers and hospitals' financial losses will result in job losses and harm in local economies. This will hit hardest in communities with the least resources. You may not be covered by Medicaid or the Essential Plan right now, and you may not be in need now. I still want it to be there for my family, parents, my friends, and my neighbors when we need it. Cutting public support for people when they need it most is a public policy choice. New York enacted the Child Poverty Reduction Act, a statutory commitment to cutting child poverty in half in the next decade with attention to racial equity. It creates an expectation that budget decisions in New York will be assessed for their impacts on child poverty and that will measure child poverty reduction over time. The passage of this legislation was an acknowledgement of the high rates of child poverty across the state and a commitment to working to address the causes of those rates. New York can do a lot, but we need our U.S. members of Congress and senators to stick with us and not leave people behind. So my opportunity here today is a call to action. I encourage you to look at local district information about the Medicaid proposed cuts at Medicaid Matters New York, MedicaidMattersNY.org, where we have fact sheets about the proposal's impacts by congressional district, and to also check out the Schuyler Center website, SCAANY.org, where we have information about some more of the proposed cuts. The U.S. Senate and the U.S. House of Representatives are making these decisions right now. The Senate is trying to get their bill passed by July 4th, and then even then it will need to go back to the House. So these decisions are being made right now, and it's very important that we use our right to contact our members and let them know if we're concerned. So if you're as concerned, sad, or ripping mad as I am, I urge you to call your U.S. senators and your U.S. representatives, email them, write letters to the editor, and communicate in any way you can that you're concerned about these cuts.
Thank you so much, Kate. Very well said. And definitely, you're absolutely right that this is an extremely time-sensitive matter because the decisions are being made as we speak. So we did get a number of questions that I will attempt to address, and I'd like to thank my colleagues here who work in SNAP program as well as SNAP employment and training, Wendy DeMarco, Sherry Tomaski, Stephanie Bozzart, and Bill Konchelik, who have been supporting a lot of this work and helping with the Q&A session. So thank you guys. The first question is whether these changes mean shifting federal administrative costs to the states or federal benefits as well. So the answer is both. As stated, the shift of the cost of the SNAP benefit, so the amounts that are being delivered to households to meet their nutritional needs right now are 100% federally funded, have always been 100% federally funded. And this would require states to pay a percentage of those costs. Every state, unless, like I said, at least 43 states would need to pay a share of benefit cost. So for New York, what we're looking at is that's up to $1.9 billion a year. And then it also will be shifting administrative costs to increase the percentage that's required to be supported by state and local dollars. A related question is a question about, with the administrative cost shift, will the decrease in the federal share be absorbed by the state only, locals only, or state and local? And so we can't necessarily be 100% sure about what will happen in the future, but right now, each county in New York City, every social services district is required for all of the non-federal share of SNAP administrative dollars. So that would be, as current rules prevail, that would be a shift to the local. So that was I believe, $168 million value that was displayed on a previous slide. And then obviously the cost that the state incurs would increase as a result of the reduction in federal funding. Another person has asked if we can make available county level data. And we certainly can work with social services districts to provide you with that information. We have both county level as well as congressional district level data also on our website with respect to the receipt of SNAP. And we are certainly, we have done our own analysis, or we're happy to share the administrative shift piece with the counties in terms of what we've estimated, but I think people can also do that on their own, but we are definitely happy to make that information available. Another question, which is a really good one, which is what are payment error rates? And I didn't really describe that much. It's something that we're very used to talking about. So payment error rates, first and foremost, do not reflect fraud. Payment error rates are determined based on a sample. There is a quality control sample that is completed every single month of SNAP issuances. And it looks at, was the amount of SNAP that was issued to the household the accurate amount based on program eligibility rules. And so it measures the extent to which it was not correct. So it could be that the issuance was higher than it should have been or lower than it should have been. I think it tends to lean toward higher, but that's what it's measuring. And it can also be both, the result of administrative error by the workers processing cases. It could also be based on information that was not necessarily provided by the household at the time the determination was made. It is not a reflection of fraud. Another question was, has summer EBT, so those are benefits that are provided during the summer months, a new program that started last year, has summer EBT figured into the error rates? And the answer to that question is no. That is considered a separate program that's not covered by the payment error rate analysis. Another question, are there any cuts to SNAP funded grant programs, such as creating healthy schools and community programs? And so if these are school-based programs, if they are funded with SNAP Ed funds, then yes. The House and Senate, right now, it looks like both House and Senate are proposing to eliminate funding for SNAP education entirely. And then another question, what about seniors that only have Social Security and no children? And so I assume that question is about the work requirements. And so if the seniors are in receipt of Social Security, we would expect they would be exempt from the SNAP work rules, including the ABOD requirements. And then a related question is, what about individuals with a disability? So there is the work rules do not apply to individuals with documented disabilities. So, and that's something that obviously we will be working very closely with districts to make sure that we are exempting as many households as is appropriate, because we know that when there are new rules, when there aren't rules in place, exemptions may not come to the forefront, right? People may not raise issues associated with their ability to work. So we will certainly be working with social services districts to make sure that we are accurately identifying anyone with a disability so that they are not subject to the SNAP work requirements. Then there's a question, will the Senate parliamentarian allow SNAP cost shifting to the states? There was a report, or there was one decision made where the SNAP parliamentarian ruled that what had been proposed in the Senate was not consistent with Senate rules. We know that there are additional questions associated with that based on some tweaks to the Senate proposal that is before the Senate parliamentarian for a final decision. We are hearing that they will allow it, but as far as we have heard at this point, there is no final decision on that topic. And then just to remind folks also at this point, this webinar is being recorded and that we will send the link to all who have registered along with a copy of the slides. Okay. Another question about implementation dates. So the benefit cost shifts as currently proposed would begin October 1, 2027. The administrative cost shifts, the House bill says immediately, the Senate says October 1st, 2026. Yep. And the other provisions differ. The work requirement proposals, our understanding is that they would be immediate. And again, none of this is final, but as Kate Breslin mentioned, these are things that are being debated and potentially could become the law of the land shortly. Okay. There's another question about how I'm assuming this is about work requirements, impact individuals who reside in shelter or are otherwise experiencing homelessness. The House version of the bill does have an exemption for individuals who are experiencing homelessness, so they would not be subject to the work requirements, but the Senate version of the bill removes that exemption. So again, no final determination, but there are differing provisions in the bills right now with respect to individuals experiencing homelessness. Okay, give us just a sec. There are a couple more questions that we try to get to. So there's a question about whether or not these changes will hinder the application and recertification process and cause lags or additional time necessary for districts to make a determination on SNAP eligibility. I don't think there's anything specifically in the bills that would do that, but we are really concerned because of the cost shift. That is a concern that it will be an additional burden on counties with respect to the amount of funding they must put forward to fund staff. And we know that the determinations rely on staff time and effort. So that's something that we are concerned with. Timeliness has been a big focus for both the federal government as well as New York State for the past couple of years to make sure that we are issuing benefits timely. We've made tremendous progress over the past 2 years, and we would certainly hope that nothing comes to play that would undermine that progress, because we know it's very important to make sure we're doing everything we can to get individuals the benefits they need as quickly as possible.
This last question.
Sure. I think this is the last question. Question is, will these cuts impact universal school meals programs? So there's no direct impact. Again, another bright spot in New York State that we were able to finally move to universal school, free school meals. And so there is no direct impact. However, families that are enrolled in SNAP may be impacted, and SNAP participation does impact the underlying funding formula for school meals in terms of the percentage of that is supported by federal funds. So thank you. Okay, I think that's it. Again, we really appreciate that so many people have joined us today on this extremely important topic. Again, my sincere thanks to Richard Buery and Kate Breslin for joining us, and to my colleagues here at OTDA for supporting the analysis and effort put behind being able to really dive deep and to analyze specifically how these congressional changes could negatively impact households and communities throughout our state. Join Kate in urging folks to call, particularly your members of Congress in the House in New York State, to let them know that this is something that you care about and ask them to not take actions that would undermine families and individuals throughout New York State. So again, thank you so much for joining us. We really appreciate it. Have a great afternoon.